Good morning, everybody. My name is Richard Soden. I'm from SUNY College of Optometry, and I'm going to present a discussion this morning about the interview process. I assume you all have already looked for jobs or may be looking for jobs, researched the jobs you're looking for, and are ready to go for an in-person interview. We'll spend a few minutes talking about the process. I'll give you some examples, and feel free to email me with any questions that you may have. The interview process is really, really important. The bottom line is that you need to show what you bring to the table, and you also need to dress for success. You need to dress in a very professional manner if you want to maintain and have an opportunity to be offered a job position. So I would truly suggest that you don't wear jeans or flip-flops, but go dressed as professionally as possible. The interview is simply an evaluation that goes both ways. You need to show that you are confident during the process. And think of the interview from both sides. You're being interviewed, and you're also interviewing the employer. It's a simple conversation which you need to prepare for, you need to rehearse it, and you need to know about the practice that you're joining. There are some articles out there that you can read about the interview process, but the number one thing to remember is to do your homework, research what the practice is all about, research what the practice has to offer, and it will be a successful interview. So let's split this up into a couple of different components, and we'll go through each one of these, and we'll talk about some questions that you should be prepared to answer. So the first thing you need to do is to research the practice. Check out what their website is all about. Look at all the different components of the website. Be familiar with the website. Know the services provided, and also check out what services they're not providing at the current time. That's really important, because if you're looking for a practice that's ocular disease and they don't have advanced diagnostic equipment or indicate that they do that, that is something that you bring to the table. Other things might include vision therapy, low vision, rehabilitation, medically necessary contact lenses, and a host of other things that may interest you. Try and get a feeling of what the patient base is all about. What kind of patients do they see, who they serve, and a lot of times that can be done by using information that's available on their website or by using social media to understand exactly what the practice does and what some of the comments about the practice are. Secondly, you need to research the optometrists or the optometrists that are in their practice. I would read their bios online. I would look and see if they have bios on LinkedIn and other social media outlets. Google the doctor, see what comes up. Where did they go to school? When did they graduate? What's their specialty? What professional organizations do they belong to? And try and get some sense of what their interests are. Again, if there's multiple doctors, you should do this for each of them. Prepare for the interview. And preparing for the interview is something that is critical. Things that you should go in knowing about are, tell me about yourself if they ask you that questions. Where do you see yourself in the next 5 years? Do you have a specialty in mind or a series of specialties in mind that you would like to bring to this practice? How can you make our practice better than it currently is? What's your philosophy or approach to patient care? What are your strengths and weaknesses? How do you think healthcare reform might impact this practice? How do you handle stress? What was the best day of practice in your previous job or as a student? What was your worst day? These are typical questions that interviewers ask. In this period of time, in the 21st century, you should know all about the practice. They should not have to explain exactly what services. You should be able to go in getting that information already and be prepared to answer questions that are more focused about you and how you can help the practice move forward. The bottom line is to always research thoroughly your prospective employers, doctors, and knowing about the practice, knowing about a hobby, relating it to a personal experience can be a big plus in your getting the job that's going on. You can also think about some examples of what you might bring to the practice based upon how many patients you see a day. Here's an example where if somebody does 4 visual examinations at $65 each and some fundus examinations, you can bring in X amount per day and additional revenue a year. You can do this for contact lens fittings, visual field screenings, many different ways of looking at what's going on. If your interest is in medical optometry, you can talk about the income that you might be able to generate from glaucoma and foreign body removals, and you can actually use this to show that it would be economically feasible for them to hire you. So once you've gone through the interview, once you've answered questions, once you ask questions about what the practice is, what the expectations are, you need to follow up. And I find that this is frequently a very overlooked step. A couple of days after, I would send a letter or an email thanking the individual for the process that you've just gone through. And sometimes this is the extra oomph that you might need, or the provider or the practice that you visited might need to get back in touch with you. Send them a handwritten note, email them. I would strongly suggest you don't send a gift. People are very, very busy these days, and usually they don't stop what they're doing to take a phone call. But I would do a message within a week of the interview, and the best message should be short and to the point. So, dear Dr. Velasquez, it was great meeting with you and your staff. I truly enjoyed the familiar atmosphere at Healthy Eyes, or whatever the name of practice is, because I see the positive experience translates to the patients. After meeting you and seeing your practice, I'm even more convinced that my approach to the patient care will be a good fit with your practice. I look forward to hearing it. And I think a simple note like that goes a long way, and follow the process through. This was a very quick discussion about the interview process. There's always a lot more that you can go through. If you have any questions, please feel free to contact me. You can send me an email. Listed below is my email. I'm happy to follow up with any questions. Good luck on your interviews. Good luck on finding your careers. Optometry is a great profession, and you'll do well, but make sure you are prepared for the interview process. Thank you and good luck.